looks like a
Yeah, there are granulomas here. There's kind of these pale nodules.
Or gout, it maybe is kind of feathery in the lighter areas.
Okay. Yeah, good. This looks very much like gout, right? It's multiple nodules of pale, light, feathery, fluffy, like cloud-like substance. And if you go close, you kind of get the impression that maybe there used to be little thin needle-shaped crystals there. And then it's surrounded by a wall of histiocytes, right? See there, look at the needle shape right here. But as you guys know, that during the processing of the tissue and staining, the urate crystals get washed away, right? So, I was always taught it was because of formalin fixation, but from some other papers I've read and some experience it seems like maybe some of it gets dissolved by formalin, but the bigger thing seems to be the processing and then the H&E stain itself, actually. So, the best way to see the crystals, of course, is to do a fresh smear, or to submit an alcohol, but you can just submit it fresh and then say, please smear for looking for gout, and then we can see the urate crystals, okay? So this looks great for gout, but this is interesting. This is like a nodule on the foot. But then we got areas like this. And here, this is like very dark purple. And some of it looks kind of needle-shaped, but is purple, like kind of like a calcium sort of look. And when we flip the condenser, yes, some are long and needle-shaped, but others, can you see them right in here? They're like diamond or square or what we say rhomboid shape, right? Like, oh, there, that's better. See them there? Way bigger, thicker, and chunkier than gout crystals. Also, they're easily visible here on a formalin-fixed H&E section, and many of them are purple, which is not the color that gout should be. So this is slightly unfair because this is something that I don't think I've ever seen actually in the skin, but this is from the foot, and I think soft tissue things in the foot can be close enough to the skin that they can come up and get sampled and sent to DermPath potentially. So it's fair to at least know about this. And I would say that even in the hands and feet, I've only rarely seen this in the hands and feet. Usually I see this in big joints, deep joints, like the knee, or I often see it in the spine, like in intervertebral disc specimens from spine fusion surgeries. And let me see if I can get the polarizing to work. I'm going to try. Sometimes it's a little difficult to catch on camera because of the light adjustment. Let's see if I can get it though. One second. Turn the auto adjust off. And then there we go. See them? And so they glow and are birefringent under polarized light examination. You can really see that rhomboid shape now. So does anyone know what this is? Yes, this is pseudogout, calcium pyrophosphate. Hold on. I'm going to turn that back on. Calcium pyrophosphate deposition disease, right? Which again, usually is they're almost always when I see it, they're clusters of purple, dark purple, because they're calcium. So they're staining purple on H&E. And then when you go closer, the crystals are preserved and they're rhomboid shaped. Although occasionally I've seen ones like this that have both rhomboid and kind of longer needle shaped ones. So the question in this case, usually just on H&E, gout and pseudogout look very different and are easy to tell apart. But this case is hard because that stuff looks perfect for calcium pyrophosphate. But over here, I thought looked perfect for real true gout, monosodium urate. So my suspicion is that this patient may actually have had gout and pseudogout both mingled together here. Now, I don't, unfortunately, have proof of that because I don't have a smear to go with this, But if you would have just given me this area, I would have signed this out. Gout, done. I wouldn't have even like questioned it or said we need to get a smear. I would have said this looks perfect for gout. That looks exactly like what gout's supposed to look like. But then we have all of these purple rhomboid polarizable crystals in here too. And this is really extensive. It's everywhere. So I think this is definitely pseudogout, but also I suspect that there may be some intermingled monosodium urate deposition in the midst of it. So kind of a fascinating and interesting case. And again, I rarely see pseudogout in the hands and feet, but occasionally I've seen it near the small joints in the hands and feet where it can come push up close to the skin surface potentially. But like I've never seen it like in the dermis itself, okay?